I will take them off mute. Good morning, everybody. My name is Heidi Boehm. I'm the TB controller for Oregon Health Authority. I have the pleasure of introducing today some folks from Multnomah County who are going to do a great presentation about some new patient education tools that they developed. I'm really excited that they made these tools. They spent lots of time on them and got lots of patient input. So these are really exciting, and thank you to everybody who is attending the webinar to learn about it. So our presenters today are going to be Lisa Ferguson. She's the nursing supervisor for Multnomah County. Meredith Jones, she is the TB nurse case manager with Communicable Disease Services at Multnomah County. And Melissa McKenney, who's the community liaison also with Communicable Disease Services. So with that, I will hand it over to Lisa.
Hi there. So this is Lisa Ferguson, and I just want to start by going over our objectives for the presentation today. So by the end of this presentation, we would like for you to understand the purpose of our education tools, including the flipbook, the client booklet, the pill sheet, and the sputum sheet. And we'll be going over each of those in detail. You'll also understand how to use the tools, where to locate the tools on the OHA website, and you'll understand how the tools could be altered to fit the needs of your individual TB programs if you want them to. So I'll be discussing the background of the project, how we decided to do the project, why we decided to do it, what our objectives for the education tools have been, and then Meredith will be reviewing the flipbook and the booklet to show you how to use it, and then Melissa will be reviewing the pill sheet and the sputum sheet. We'll review how to locate the tools and then answer any questions that you might have. So as we all know, when we're working with TB clients, it can be really challenging, especially when you first get started with your clients. We usually go to their home to do their initial visit, and that can be a really lengthy visit, 2 or 3 hours that you might spend with a client going over what TB is, basic education about contact investigation and about treatment. And sometimes you're using an interpreter, which can make it even longer and more complicated. A lot of the education materials that are out there are very detailed and text heavy. We also know that treatment is long and difficult. There can be a lot of changes throughout treatment. Pill regimen changes. We're asking people to get different tests throughout their treatment, and it can be complicated for people to understand. And then everyone has their own individual cultural experiences that impact how they respond to the diagnosis of TB. And so we'll talk about how those things impacted our decision to make these tools. So in Multnomah County, when we started thinking about this project, we looked at who are the clients that we're serving. So you can see from 2014 to 2016, we had 84 active TB cases. And 82% of those people were born outside the United States and spoke 16 different languages. 30% of the clients did not speak the most common languages. We're very fortunate in our department to have case managers who speak Spanish and Vietnamese, but of course there are people who speak a lot of other languages, and so we're using usually phone interpreters to do assessments and visits with those clients. We also know that there can be barriers to TB care, some things that can impact somebody's ability to learn and be able to make informed decisions. There can be cultural stigma around TB depending on where somebody is from and how people might respond to the diagnosis. It could be something that they don't want others to know about. They may come from somewhere where having government involved in healthcare is unsettling, or they're uncomfortable with that. Their own language may be a barrier if there's a lot of materials in English and they don't speak English. And also even at times when we are able to translate into other languages, they may not have literacy in their own language and be able to read the materials even if we are able to translate them. So we know that client-centered care is the optimal way to be working with our TB clients, that we really want to look at what are the needs of the client while we're also examining our own goals and what we want to accomplish with treatment. But client-centered care is not easy. It's very time intensive. You know, you really have to put a lot of effort and focus into what are the needs of the client, what is their response, their family's response, how can we work to make sure that they are able to make informed decisions about their care and that they understand their TB treatment and their diagnosis. It's an investment. You know, it takes a lot of effort up front at the beginning of case management with a client to really make sure that we're providing client-centered care. And we realized in our approach when we decided we wanted to come up with some education materials that we wanted to have client-centered care as our focus, but that we needed to bring in someone else besides ourselves. And so that's when we asked our communications team to be a part of this project, because we knew they had an expertise in how to best communicate to people with us being able to have a client-centered care focus. So when we decided to take on this project, the objectives that we had are we wanted to provide client-centered care for individuals diagnosed with TB, and we wanted to support clients in being able to make informed decisions about their TB care through relatable, informative, equitable, and engaging health education. So with those objectives, then we sat down with our communications team, and Melissa is our community liaison who has worked with a lot of organizations in the community. So as a team, we started talking through what are the pieces that we want to have in this education. How do we want to approach it? So the main criteria for us are that we wanted to use a lot of photos and illustrations in place of words. We received a lot of feedback from other groups too, and talking about what are the needs when we're talking to people who have English as a second language or who may not be literate, and so this was also developed with feedback from outside agencies who work with refugees or immigrants. And so it was really suggested that we use more pictures in place of using a lot of words in the material. And that we really wanted it to be relatable to anybody, so that when people are looking at the materials, they can see themselves in it and they can relate to what's happening to the people in the education materials. So we really wanted it to be culturally agile and racially ambiguous. We wanted this to represent anyone's values, and so we chose to have simple, modest characters of all ages and all genders. And we wanted it to represent our own public health values and our approach, like I said, with client-centered care. And then we also wanted to have plain language for the educator to use, because this is not just a tool for the clients, it's a tool for us as educators to our clients to be able to walk through step by step and know what we're talking about next and how those things relate to each other. Okay, so I'm going to hand this over to Meredith now, who will start talking about the flipbook itself.
Okay, good morning. So, we wanted you all to see the flipbook in action, so we created this little video for you. The sound is poor, and we apologize for that. We're going to try and make it as loud as we can on our side, and it might be helpful for you to turn up the volume on your computer to hear the sound. It's just about a minute long.
Hi Maria, thank you for coming in to see me today. As you know, you've been diagnosed with tuberculosis, and so today we're going to talk a little bit about what tuberculosis is and some of your next steps. Okay, so we're going to use this. This is our tool that we use to talk about tuberculosis, and it's going to help guide our conversation today. So we're here today because you have TB disease or tuberculosis disease, and we want to help you get better. I'm a case manager from the Multnomah County Health Department. I'm a nurse, and I'm going to tell you more about what that means in just a few minutes. But first, let's talk about TB. Okay, so I'm using TB and tuberculosis interchangeably. They mean the same thing. TB stands for tuberculosis. And TB disease is caused by the tuberculosis germ. So the germs are bacteria, and they can make you sick. And TB disease happens mostly in the lungs. You can see here on this picture, the TB disease is in the lungs and it's making this lady cough. But the TB disease can also happen in other parts of the body. You can have it in your brain or in your kidneys or in all these different parts of your body. For you, the TB disease is in your lungs, and that's why you're getting sick.
So that's just a brief example of how we use the TB Flipbook. Okay, so now let's talk about the Flipbook. First, we're going to start with the features. It has this nice kickstand, so it stands up between you and the client, between the nurse and the client. It also has a spiral to easily flip through and navigate each page. And then we've got some tabs here. The tabs serve for different grouping of education materials. So if you want to focus on a particular area, you can easily navigate to that tab. Or, you know, in client-centered care, if the patient's very concerned about this one aspect of TB treatment or of isolation, you know, you could deviate away from the plan that you had to go page by page and navigate to that section and answer their questions so you can put them at ease and then go back to what you were working on. Okay. So we, like Lisa talked about, we wanted this to be a visual tool. So you'll see that on the patient side, this is the patient side, the color side, there's not any words. It's not necessary to rely on text to convey a message. You know, and the feedback from the community, from various community groups, was that the written education materials that we're providing people, if they were in English or if they were in translated to a different language, folks weren't really reading them. It was overwhelming, the amount of text. They would, you know, take them home but then throw them away and then just ask friends or family members, how did you take this medicine? What do you think I should do? And we really wanted the clients to take our education to heart and you know, really have the information they need to make informed decisions about their care. And so that's why we decided to pursue this visual approach. So we used illustrations to show things that are too small to see. So here in this picture you can see the TB germs or the bacteria. And then this superhero guy in green is the immune system. So what we did is we made the TB germs the bad guy and the immune system the good guy, and kind of use it to tell a story and to make the TB disease diagnosis more relatable and understandable. This is another example of putting the chest x-ray and the image of the lungs side by side to kind of, you know, it's hard to understand about things you can't see. You can't see the bacteria in your body. They're small. You can't really see your lungs, and this just kind of gives a perspective of what the TB germs are up to and why it is that we're taking chest imaging to understand that. Then we used photos for activities that we wanted the client to do in real life. So in this one, this is sputum collection. I don't know about you all, but sputum collection is so difficult to explain. Sputum's not spit. You want that deep mucousy stuff from the lungs. And doing the step-by-step with the pictures with some, you know, nurse demonstrations helps to really to get that point across. Another example that we use photos for were things that we did or did not want the client to do. So when we say, you know, we'd like you to stay home on home isolation, that means not going to the grocery store, not driving and visiting places, not getting on TriMet, or once you're off of isolation, now you can get on your transit, or you can go to the grocery store, or you can drive over and visit your friends. So we use the pictures to demonstrate things that or actions that we wanted the client to take, or in some cases to not take if they're on isolation. Okay, so now we're going to talk about the utility of the flipbook from the nurse's side. So this is what the nurse sees. The client sees the images, the color illustrations or photos, and then on the other side is what the nurse sees. So there are kind of like prompts for the case manager, some key messaging that the case manager can review and really shape and mold the education that they're giving to that particular patient. There's also a, I don't want to call it a script, but like verbal prompts. And, I often use these exact words and then expand if the client has questions. And then at the top are what I would call transitions. So as I flip a page from one to the next, I'll say, now let's talk about some basic information about TB. So I'll use the title that's written there at the top, and then I'll go down to the bullet points about what I should say to the client. And then also on the case manager side, so the black and white photo is on the case manager side and the color photo is on the client side. So it helps orient the nurse to what they're seeing, what the client is seeing, so that if you want to reference one of the images and one of the pictures, you know what they're viewing, and you can reach over and point and say, now this is what TB in the lungs could happen, or you could have TB in the brain, and you can move down the pictures. So each page of the nurse's view has the image that the client is seeing. Okay, and then there's also, so when we created this book, we wanted it to not just be an education tool, but we wanted it to be something that could help the nurse or the case manager navigate the entire first appointment. So that initial interview that Lisa was talking about that can take, a couple of hours, this from start to finish walks you through all of the pieces of that. So there are images of documents on the client side, and then on the nurse side there are prompts that say you should fill out this form. So there's a prompt to go through initial TB evaluation. I know we have a list of questions that we ask all of our clients, and that's what this is prompting the nurse to do. There's also prompts to sign the TB medication consent form or the directly observed therapy agreement. There's prompts for the agreement to help stop the spread of TB. And then there's a prompt for the authorization for release of information or coordination of care. And then we also have a prompt, if the client is on isolation, they can't go to work, or it's a child and they can't go to school, this is a good reminder for the nurse case manager to offer a medical excuse letter for the client if that's something that they do. So something that we found from this project is that it's really been helpful in providing a consistent structure for TB education across the case managers. So in our group, we have 4 folks who do these types of appointments, and it's really helped us be consistent in our education that we provide. We all cover the same information, but it was done in different ways and at different levels or at different depth, and this has been really helpful to just help us be consistent. It reminds us to include every single piece. It's so much to remember. You can forget to do that one piece of information, and this has really been a great guide to remind us to cover all of the topics that we need to in that first appointment. So I also want to talk a little bit about using this book with interpreters. So in the video, Maria and I, we did this appointment in English, and when I use the flipbook and my client and I speak English, the appointment usually takes about an hour and 15 minutes to do all of the pieces, and that's from start to finish. That's TB education, that's filling out the forms, that's taking medication or reviewing medication and taking medication, that's talking about sputum collection and talking about contact investigations, home isolation, doing your lab work, like all of it together. It takes about an hour and 15 minutes, hour and 30 minutes with the booklet in English. When I do it with a phone interpreter, most of the clients at the initial appointment are infectious or contagious, and so we can't use in-person interpreters, we use phone interpreters. And with the interpreter, the appointment takes about double. It's a slower process, but it's very effective. What I really love is that the book, the little bubble that says say the following, and it has all the points that you need to list, it's written in plain language. And having it written in plain language, there's no jargon, there's no slang, it makes it really easy for the phone interpreter to interpret. When we tested the booklet with community organizations, we did test it with interpreters, and their feedback to us was to give the interpreter context. So when we start the interpretation, me as the nurse case manager, I say to the interpreter, we're doing our initial evaluation for a TB diagnosis. I'm going to be using a flip chart or a flip book to navigate the appointment. I'm going to be referencing images on the book, and I just want you to know what the client is seeing, because obviously they're on the phone and they can't see the booklet. And there was in the testing a little bit of confusion with the interpreters. So I think the feedback there was it's really important to orient the interpreter to the tool that you're using before you start using it. All right, so that is the flip book. Now we're going to transition and talk about the booklet. This is the second tool that we developed. First we focused on the flip book, and then we went on to develop a TB booklet. This is basically what we call the take-home version of the flip book. So the slides are the same. You can see the images there in the booklet and the photo. They're the same images that were on the TB flip book. And so we put all of the slides from the TB flip book into the booklet, and then we gave brief, plain language descriptions of the slides down below. This is another view, probably an easier view to look at. So we took, the verbal prompts for the case manager from the flip book and kind of put them into more narrative form there below each of the slides. Okay. So I will say that the TB Flipbook is really helpful for family members if they read English, or we have it translated into several other languages, because a lot of the family members, they can't be there in that first appointment. Either the patient is contagious and they're trying to limit their exposure, maybe they work during the day, and so giving the patient the flipbook to have at home, it's really helpful for the family members to kind of review all of the information and have a good idea about what's going on. We really like the side effects page. So the side effects page is in the flipbook, but this is something good that the client can reference at home to know what side effects they need to be looking for and what they need to do if one of those side effects occurs. And like I said, we did translate this booklet into many different languages. We have it in simplified Chinese, in Russian, in Somali, in Spanish, and in Vietnamese. And we picked those 5 languages because those are the most common languages spoken by Multnomah County clients. But I think, if there's another language that clients speak in your jurisdiction, or if we see a need in our jurisdiction for more languages, I think there's definitely opportunity to expand our collection here. Okay, so that is all I have about the TB Flipbook. And I'm going to pass it now to Melissa, our community liaison, to tell you about the other tools that we've created.
Hi there. I am going to open up the tools that I need, so just give us a second here. Okay, so the first thing that we're going to look at together is what we're calling the tuberculosis pill sheet. This, both of the tools that I'm going to talk about are meant to accompany the other take-home booklet. So these are things that would be left behind with the client to refer back to as they're sort of getting used to this new reality of treating TB disease.
So the first one is the tuberculosis pill sheet, and it really is, its purpose is really just to help the client understand the pills that they are taking in those early days of treatment, when they have this really unusual experience of having someone deliver medication to them. It just gives them a little bit more power and understanding of what's going on with their body and what they're putting in their body, and hopefully makes them feel a little bit more comfortable with the process. So the case manager would fill this out ahead of time and print it, and I'll actually, you can kind of follow along as I do it. So there's all kinds of information. So the case manager would put the client's name, they'd put their name, phone number, etc. If the pills are being delivered by a different person, then they would have that person's name, their phone number, and then as you go down, you have an open text box here to say that, you know, this person needs to take their pills daily, or maybe it's, you know, only on Tuesdays and Thursdays. You can change it around depending on what that person's regimen is. And then the next field is I take my pills in the morning, afternoon, evening, whatever it is. And then there's a visual cue for folks who you know, can't quite read it, or maybe better understand looking at a picture. So this person is going to take them in the morning, or that's when they're going to be delivered, and then we have the little sunrise picture. So then the best part about this pill sheet is what happens when you select the pills. So on the second page of the sheet, as you'll see, there's a whole bunch of different choices of medication. And so this particular person has been prescribed isoniazid, I can't say that word, 300 milligrams. They're not prescribed Moxie, but they are prescribed either, you know, obviously either rifampin or rifabutin, and this person is getting 2 caps. So I'm clicking, you can see what I'm clicking. What's happening over on this screen is that the pill pictures are popping up. So let's see what else. Ethambutol, there we go, there's that. Sorry, it keeps moving itself over here. And then there's that, and then the pyrazinamide, got that one. That pops up, and then the vitamin B6. So you can see that on the client's side, all the pictures are there. It tells them how many pills to take of that particular medication, and then it gives them the name of it. And then as a case manager, when you show up to the appointment, you only print the first page. Obviously, you do not print the second page with all the pills or all the different options. And so then the great part about this is that, it helps the client understand what's happening at the very beginning, but then if their drug regimen changes, the case manager could print a whole new version with different pictures, or maybe the person that's delivering the pills has changed, or even their case manager has changed. It's just a great way to keep the client in the loop and better understanding what their particular treatment is. They could put it on their refrigerator or just tuck it in, but they can always refer back to it or give it to a family member so they understand what's happening. So the next tool that I'm going to go over is called the sputum collection sheet. Sputum collection guide. So as Meredith already alluded, it is quite difficult to explain how to collect sputum. And the utility of this tool is really a step-by-step guide to help the client the first few times that they do it alone at home. So it tells them in the very top box the things that they'll need in order to accomplish the task. And then it goes through steps with 1, 2, 3, go on through the steps with very clear pictures and with as few words as possible. You've probably all seen a number of these types of guides or instruction sheets, and they tend to have a lot of words because it is a very complicated process to explain. But we found that that's not necessarily, more words are not necessarily more helpful, so we opted for really descriptive, really clear pictures, and we took a long time to get this the way we wanted it. But so you can see it kind of walks through exactly what the thing you need to do, put the bag here, put the next bag there, put it in the refrigerator, etc. And the best way to use this tool is in conjunction with a nurse who has shown the client how to do it physically there with the tube, shows them all the different things to do. And then the client can take this home, put it on their fridge or whatever, as a reminder of what that nurse has already showed them how to do, the process. So that is the sputum sheet. Let me get back in here. So now I want to just talk really quickly about how to access the tools. The flipbook and the take-home booklet have been posted on the website. The other two should be posted soon after they've been reviewed. Let's see if this will open. So the tools are posted on the Oregon Health Authority, the TB program's website. You'll go to this link. It'll be in the presentation. You go to the case management little tab, and then here it is. The patient education flipbook, that's the big one, and then the take-home booklet is here in all the different languages. And then if you want to access the materials and do some editing on your own, we are very happy to share all of these tools. We do own the photos and illustrations, so we just ask that you give us credit. But you'll see on this slide there's contact. Our friend Alejandro is very happy to send editable files. You'll have to have a conversation with him about the best way to do that, but we're very happy to share. And then now Meredith's going to just talk about a few next steps before we wrap up.
Okay, so, we've been using these tools. The flipbook itself we've been using for probably about 6 months now, I would say. We had the flipbook and the booklet finished kind of at the same time, and we've been using, I guess, both of those for about 6 months. The pill sheet and the sputum sheet are just now being finalized, and we're about to put those into our regular use. And I have to say that, the flipbook and the booklet have both been really well received. The clients really like the tool, they like the pictures. I feel like as a case manager, I really like having the flipbook as my guide to assure myself that I'm not missing any one piece. I have to remind myself to trust the flipbook. Sometimes I get ahead of myself, and then, I'll get down a few more pages and I'll say, oh, I got ahead of myself. But it's been a great guide, and I've really enjoyed using it. We did test the booklets and the flipbook. Actually, we've tested all the tools now. We tested all the tools with some community organizations, and we hope to do a more formal review of the tools once we are used to using them, and trust the flipbook completely and don't get ahead of ourselves. And we would really like to do an evaluation to see how useful the tools are, because just from our own experience we think they're useful, but we would really with client-centered care and informed decision-making being our objectives, we really want to make sure that they are the best tool for the clients. So with that, I think we have finished the main body of the presentation, and I'm going to pass.
This is Lisa. I just want to also add that if you are interested in printing the flipbook, like in the flipbook format, there are some specifications of, we worked with a printer to have that done. So certainly you can reach out to us, and I think our emails are, is there a slide with our, yeah, are here. So you could reach out to us or to Heidi if it's something that you need some help with actually getting it printed.
Okay, so I'm going to pass the baton back to Heidi, and we're going to open it up for questions.
What is it? Star 7-1?
To place, all participants are now in interactive talk mode.
Okay, thank you to to Multnomah County for that wonderful presentation. We are now available to take your questions. Everybody is off mute, so if you have questions, please go ahead. Let us know. Don't see any questions online. Any questions out there?
This is Christy from Tillamook.
Hi, Christy.
Hi, are you going to have some of these at ORAPI?
We could, sure.
Yeah, we have a couple people from our team going, so we could send them with some.
Yeah, sure. I'm not sure where we would put them, but we'll work it out. We don't have a session on the flipbook at or EPI, but yeah, certainly we can bring some.
Yeah, that'd just be nice to see and look at them. And yeah,
Great.
thanks.
Sure. Other questions? Give you a couple of minutes here to get yourself off mute and think of questions. And if not, then we will end the webinar, but we'll give you a couple more seconds.
Hi, this is Carol Lee and Renee from Clackamas County.
Hi.
Hello. I don't have a question. I just want to say thank you because this is amazing and I'm really excited to use it. And that med sheet is phenomenal. I can't wait to use that with our patients. This is great.
Good.
Thank you.
Yeah, thanks.
Okay, so thank you for that feedback. And then I have a question here. Is there a way to order a printed copy of the flipbook with the spiral binding and all? So, yeah, if anybody is interested in that, why don't you contact me and we can figure out how to get that done. My program at Oregon Health Authority, we're not planning on printing up a bunch of the spiral bound copies, but we certainly want you to be able to get that if needed. So call me and we'll figure something out. Other questions? Okay, looks like we don't have any other questions, so thank you so much, everybody. You have all of our contact information. Call us if you need anything. Bye-bye.
It recorded really well, except for